I'm going to talk about how diabetes affects the feet. Diabetes affects the feet mainly in two ways: by impairing the nerves that goes to the feet, and by also reducing the blood supply that goes to the feet. Now, by impairing the nerve damage, what happens is you cannot feel pain, you cannot feel temperature differences, whether the object is cold or hot, and by that you end up not being able to feel if there's an injury on your feet. Now, if you don't feel an injury, you may not be able to notice the injury earlier and treat it as soon as possible. And that will lead to infection going into that injury, and infection, we know, will ultimately lead to amputation. With arterial deficiency or lack of blood going to the feet, when you have the injury, unfortunately, you need blood to heal and repair the injured part. And if you don't have that enough blood going to your feet, that area is going to turn gangrenous and ultimately lead to amputation. Education is important in preventing these injuries. Now, what should you do to try to prevent this? The first thing that you need to do is you need to visit your clinic or your hospital for a doctor or a healthcare provider to try to ascertain whether you already have the arterial problem or problem with circulation on your feet, or you already have a peripheral neuropathy, which is damage to your nerves. A regular visit to your doctor or your healthcare provider in your local clinic or your hospital is important to try to ascertain whether you have nerve damage or you have impaired circulation to your feet. What you need to do is you need to check your feet regularly for anything that is abnormal, and this can include any discoloration that you see on your feet, any cuts, any bruises, any blisters, and you need to go to your healthcare provider to try to prevent that getting worse. You need to wash your feet daily. You need to dry properly in between your toes, and you need to cut your nails. And cutting your nails, you need to cut them straight across, and with a file, you file the edges of the nails. You need to avoid walking barefoot if you have peripheral neuropathy or if you have the arterial deficiency on your feet. You need to wear proper shoes. Now here I've got an example of proper shoes that you need to wear. The shoe have to be protective to your toes so that you don't injure yourself in case you wake up in the middle of the night, you go to the toilet, you are half asleep, you kick something, you know that your toes are protected, okay? It has to be made of a material that is breathable. And it has to have fasteners, and ideally we recommend fasteners such as Velcro, because we know our feet later during the day, they tend to swell a little bit, so you can always adjust your shoes, okay? It has to be made of a rubberized sole, and it should not be high-heeled, and it needs to have a heel counter so that it supports your heel, okay? And the shoe has to be flexible enough, because we know that our toes, they do bend as we walk. This is meant for ladies, and the same one also applies to our men. Still on the subject of shoes, it's important that when you buy your shoes, try to buy your shoes in the afternoon or in the evening when your feet are a little bit swollen. And in that way, you'll be able to get an appropriate size that can fit very well. And when you buy the shoes, you always have to wear both shoes and walk in them, and they need to feel comfortable in them. You should not expect the shoe that they will stretch as you use them over time. The shoes has to fit immediately once you start wearing them. You need to stop smoking if you are a smoker. You need to start to exercise, and you really need to control your blood glucose levels. With those basic points, we can be able to prevent amputation and reduce the level of people who are losing their feet due to diabetes.